So for the next birth injury, which we'll look at, this is what is known as Erb's palsy. So anytime you hear palsy, there was an injury to the nerves. Alright, so Erb's palsy is like this. Alright, so there's an injury to what? The brachial plexus. Brachial plexus is a group of nerves that pass from your neck down into your hand. So it's like this. When you are pushing the baby out, you are trying to, the healthcare provider outside is trying to like drag the baby out. Sometimes you might drag the neck too much and the shoulder is hooking somewhere. So it might cause an expansion between the head and the neck of the baby. It can damage the nerves there because babies are so fragile, you know. So it's a form of brachial plexus injury, all right. It affects the upper arm nerves, often occur during childbirth. It leads to weakness of the hand and paralysis in the shoulder, all right. So you can see how the person grows and their hand is turned to the back like that, you know. So it's sometimes called what? Erb-Duchenne palsy. So causes is shoulder dystocia. So the baby's shoulder got stuck somewhere while you were just dragging. Excess traction. You were just dragging the baby without checking things. Forceps or vacuum assisted delivery. Large birth weight. The baby was so large to pass through, okay, the birth canal. Maternal diabetes or obesity. So signs and symptoms is what? Waiter's tip. Okay, so the baby's hand is turned to the back. So they call it the waiter's tip because maybe if somebody gives you something in a club, somebody serves you drink in a club and you want to like add them some money, they just turn their hand so that you put the money. So that's why they call it the waiter's tip. There's limited movement in the shoulder and the elbow. Absent moral reflex on the affected side. When they hold things on that affected side is weak, the grip is weak. Right, numbness, they don't really feel on the hand too. Muscle atrophy if untreated. So diagnosis is just physical examination. You can see it, you can see the problem. All right, imaging to see if there's any nerve damage, to see the nerve damage and if there's any fracture. All right, then nerve conduction studies. Treatment is what? Physical therapy, where they're just trying to massage the place and all. All right, Botox injections, sorry. All right, to relax muscles, to aid the weaker ones. Then surgery. Okay, they can do nerve grafts, transplants, decompressions, and all of that if the risk of the damage is getting so high.